Neurological disorders, Parkinsonism, and Alzheimer's disease. Parkinsonism pathophysiology. Dopamine, acetylcholine, and GABA all have problems in the body. Oftentimes, when we treat Parkinsonism, we treat it with anticholinergics, you've heard that term, dopaminergics, dopamine agonists, COMT inhibitors, and MAO-B inhibitors. Here are some examples. So we'll start with anti-Parkinsonism, anticholinergics. We start with benztropine or cogentin. It's a drug used to treat Parkinsonism. It inhibits acetylcholine release. Nursing interventions include vital signs, urinary output to monitor for urinary retention. Remember your parasympathetic, sympathetic chart. Increase fiber and fluid. No alcohol, cigarettes, caffeine, or aspirin. Chewing gum will help with some of the dry mouth. And sunglasses are very helpful. Anti-Parkinsonism, dopaminergics. Dopaminergics work a little bit differently. One that's used and is used very often is carbidopa, levodopa, or cinnamate. It's converted to dopamine in the body. Side effects include fatigue, insomnia, dry mouth, blurred vision, orthostatic hypotension, palpitations and dysrhythmias, urinary retention, nausea, vomiting, dyskinesia, depression, and psychosis. Dopamine agonists stimulate dopamine receptors. They can be taken with levodopa. An example is amantadine or Symetril. Anti-Parkinsonism drugs oftentimes require blood work, vital signs monitoring, no alcohol, and no high protein or tyrosine foods. So anti-Parkinsonism drugs may be taken with low protein foods to decrease GI upset. Food does slow drug absorption. High protein foods do interfere with drug transport to the CNS. Foods high in vitamin B6 include lima beans, navy beans, kidney beans, and cereals. Vitamin B6 inhibits conversion of levodopa to dopamine, so people should not be varying those types of things in their diet. A conservative amount of B6 is needed to prevent a B6 deficiency, but like I said, no variations in that, and it's easier to manage. Abrupt discontinuation of anti-Parkinsonism drugs may cause rebound Parkinsonism. Nursing interventions would be to watch for orthostatic hypotension, administer drug with low protein foods, avoid B6, alcohol, or other depressants, do not abruptly discontinue, warn of harmless brown discoloration of the urine and sweat, assess for suicidal tendencies, assess symptom status on and off, and monitor blood cell counts, liver and kidney function. The next thing that we want to talk about are meds that are used for Alzheimer's disease. These diseases are often incurable. This disease, is incurable and is dementia. So Alzheimer's as a dementia disease is chronic progressive neurodegenerative. There's marked cognitive dysfunction. Onset usually occurs between the ages of 45 and 65. Neuritic plaques form. Neurofibrillary tangles are in neurons, and they are actually not found until autopsy. Cholinergic neurotransmitter abnormality occurs in this illness. There's memory loss, confusion, inability to communicate, aggressive behavior, depression, psychosis, progression to loss of memory, logical thinking and judgment, time disorientation, personality changes, hyperactivity, tendency to wander, inability to express oneself, and later hostility and paranoia. Alzheimer's meds, so acetylcholinesterase inhibitors or cholinesterase inhibitors. You've heard that term before too. These include Tacrin, donazepam, rivastigmine, Exelon is the other word for that, galantamine or razidine. The actions, uses, side effects include that the action is to slow acetylcholine breakdown and promote acetylcholine binding to the receptors. Okay, so if we're promoting acetylcholine binding to the receptors, this is going to result in that parasympathetic side of that chart that we talked about. The result is increased cognition sometimes. Some, like Exelon, can slow the progression of the disease process. Rivastigmine, or Exelon, side effects include anorexia, nausea, vomiting, diarrhea, constipation, abdominal pain, GI bleeding, dizziness, depression, peripheral edema, dry mouth, dehydration, restless leg syndrome, nystagmus, and adverse reactions include seizures, bradycardia, orthostatic hypotension, cataracts, myocardial infarction, and heart failure. So I just want to make a note that even though these are cholinesterase inhibitors and they're promoting acetylcholine reaching that receptor, and they're promoting that cholinergic that results in the parasympathetic, they may have constipation, but here it says diarrhea or constipation. So it all depends on the person. Now, so we think of a concept called pharmacogenetics that we're going to talk about later. But depending on the person and how their receptors are set up, that's how it's going to affect them.